So step 1 is on the left hand side. If you can see this red marking, on the red marking this guide will be sitting, and this is just a dummy. So this will be sitting in this fashion, like this, in the red marked region, in this fashion. Now the point is, the hole that we have kept, there are two holes, one is this and second one is this. These are the dummy guides. What we propose is, you use this guide just for trimming of the bone, and the moment this guide sits, then you go for the titanium guides. So when you fix this, on this side, which is at the anterior side, as you have suggested, this implant should come out at the canine region, and this one should come out at the second premolar region. So the direction will be like this, and from here the tool will be going. We have kept the hole of the guide as around 3.7 mm, 0.2 mm is the tolerance, and the size of the drill that has to be used is around 3.5 mm. So from here one thing will be going, and then you can see the drill passing on this red marked region. So we exactly know that the drill direction is correct. Then it passes to the second slot, like this thing, and then it goes to this thing, to till this region. I propose that the length of the implants that were used at this region is 50 mm in length, and similarly for the same procedure, which for the second this thing, from here you have to do the drilling. This bone will go off, and then this will be passing all the way to this region, and posteriorly the length of the zygomatic implant is around 40 mm. So step number 2 is, similarly you have this guide, and now in this guide there are 3 fixation holes, 1, 2 and 3. You have to use 1.5 mm diameter screws to stabilize this guide, and then similarly you have on the right hand side. So right hand side also I have done the red marking, and in this region only that will be going to sit. Now here the bone that you can see in this region, the edentulous case, and in that you have to do some of the trimming, and then you fix this guide. And when the guide is fixed, when you are sure that okay, both the things are getting fixed, then you remove this, thing also, and then you can go for the placement of the final implant guides, like this. Now these are made of titanium, so it can sustain all the forces. In this case also, again 1.5 mm diameter screw has to be used, and when you are fixing the plastic guides, use only 1 or 2 screws for the stabilization, but when you are going for the titanium guides, you can stabilize it with all the screws, like this. And similarly this will happen on this side also. So this will be placed like this, and you have all the holes like this coming out at this in this direction. I suggest, when you do, if you can go for a mock surgery, that would also be great. I will be also marking the length of the zygomatic implants from this region to that region in the PDF. I'll also send you the snapshot of the same, so you exactly know what is the depth of the implant that you have to go. But I suggest only use directly 3.5 mm drill, because there is a lot of variation in the hole size, and the drill might rock at the same hole position.